In this video lecture, we're going to be discussing different types of transfusion reactions. A transfusion reaction is any unfavorable transfusion-related event that occurs in a patient during or after transfusion of blood components. Oftentimes, what happens is you'll see agglutination or hemolysis of red cells that have been transfused into a patient due to the presence of antibodies in that patient's plasma. Either of these things happening can cause some pretty traumatic events, and obviously we try to avoid them in any way we can. As you can see here in this picture, what's happening is we have a patient who has anti-B antibodies receiving type B blood. And what that does is the antibodies that the patient have coats the red cells and activates these proteins known as complement. And complement, basically, end result of complement activation is the destruction of the cell. And so this happens pretty frequently in transfusion reactions, although it's not the only type of reaction that can happen, and we'll talk about them all as we continue here. Keep in mind that there are more antigens than just the ABO groups and the Rh types that can cause the kinds of things we're going to talk about. Hemolysis is the most dangerous result that can happen as a transfusion reaction occurs. And as you can see in this picture, there's a lot of different symptoms that are associated with hemolysis, including chills and fever, blood pressure drop and potential uncontrollable bleeding, a sensation of heat at the area of transfusion and pain in the back, increased heart rate, chest pain, and hemoglobinuria and hyperbilirubinemia. So what's happening here is as we are destroying the red blood cells, all of their insides are being spilled out. And because of that, you're going to see an increase in free hemoglobin and a using of the haptoglobin that's circulating to bind the hemoglobin. But there'll be too much for the haptoglobin to handle. So you'll have a lot of free hemoglobin as well as the iron that's in there circulating, which can cause some pretty severe damage, especially to the kidneys. You're going to see hemoglobin in the urine, and you're going to see things like bilirubin in the blood. When you have a decrease in blood pressure and an increase in heart rate, that is a sign that the patient might actually be going into shock, which is a very dangerous situation. If hemolytic transfusion reactions aren't treated immediately, they can result in death. Normally, reactions of this magnitude happen early in the transfusion, within the first few minutes, 15 to 20 minutes roughly, but they can go on a little bit later. What'll happen originally is the patient will get the chills and the fever, and they also feel like something is off. If you read, sometimes patients describe it as a feeling of impending doom because they know something's wrong and they can tell. And then all of the rest of these symptoms here sort of follow suit. So it's not something to be taken lightly, and it needs to be closely monitored and treated immediately if possible. Although hemolysis is the most dangerous, it's not the only type of transfusion reaction that can happen. We can classify transfusion reactions based on a lot of different criteria. For example, if the transfusion reaction happens within the first 24 hours after transfusion, we consider it an immediate reaction, versus a delayed reaction that can happen after 24 hours. Usually a delayed reaction is a result of activating your secondary immune response. So within 3 to 5 days after the transfusion, your secondary immune response kicks in and reacts to the cells that you've been given. So in this case, it would happen to someone who has already been sensitized to that kind of cell. So they've been exposed to a cell with a particular antigen on it prior to this transfusion. And it's not until they get the second transfusion of that cell with that antigen that their secondary immune system sort of kicks in and causes the problem. So it doesn't have to be right away, and it doesn't have to be quite as violent as the acute hemolytic reaction, but there can be other types of delayed reactions, and we'll see that. Transfusion reactions can also be immune, as we've talked about, which is an antibody-antigen reaction, but they don't have to be. There are other factors that can cause a transfusion reaction, such as giving someone too much blood or having them build up too much iron in their system. And you'll see that those aren't necessarily caused by a reaction between the patient and the donor blood. They're caused by other factors from the transfusion itself. As I said, hemolytic transfusion reactions are one form of reaction, but not all of them are hemolytic. And lastly, they can range from mild symptoms to very severe. One of the most common things that occurs after a transfusion reaction is fever, and so that's not something that is a major concern, but a patient might want to be monitored if their temperature did start to rise after they got their transfusion. Also, there's allergic response potential if you're getting another person's blood. And then more serious things include shock, as I mentioned before, or even death. On the next 4 slides, I'm going to give you different situations that cause transfusion reactions. And I'm going to have you decide if it's an immediate reaction or delayed, and if it's an immune reaction or non-immune. Pay attention to these questions because you're going to be answering them in your Canvas quiz. And you'll see what I mean on the next slide. So what you have here is a situation that can occur and cause a transfusion reaction. I'm going to describe the situation to you, and you're going to decide which of the following choices, A, B, C, or D, best applies to this. Then you're going to answer these same questions in your Canvas quiz, and be prepared to answer some more like it in class as we discuss. So the first topic we have is circulatory overload, and in this case what's happening is blood is being transfused to the patient too fast. This caused the patient to have chest pain, headache, tachycardia, hypertension, and dyspnea. Based on this description, determine if a circulatory overload is an immediate immune transfusion reaction, immediate non-immune, delayed immune, or delayed non-immune transfusion reaction. The next issue we have here is something known as graft versus host disease, and it's not just related to blood transfusions. This can happen in tissue transplantation as well. And in this case, what's happening is the white blood cells from the donor blood are attacking the recipient's tissue antigens. This happens after a few days, and you can see some tissue damage as a result. So would this be immediate immune, immediate non-immune, delayed immune, or delayed non-immune? Next we have TRALI, transfusion-related acute lung injury, and this is pretty serious and can be very fatal at times. In this case, they're not really sure what the cause is, but they believe that the patient or the recipient has anti-white blood cell antibodies, and when they receive the white blood cells from the donor, it causes them to clump in the alveoli or little air pockets of the lungs, and this clumping can result in capillary damage and edema, which is swelling, within 24 hours after transfusion. It can be pretty bad because the lung function drops significantly, and when that happens, it makes it very hard to recover from. Would this be immediate immune, immediate non-immune, delayed immune, or delayed non-immune transfusion reaction? Last, we have iron overload, or hemosiderosis. This occurs in patients who have to receive frequent blood transfusions given their different conditions. And after those multiple blood transfusions, the iron from the blood begins to accumulate in their tissues and affect their heart, liver, and endocrine glands. So would iron overload be an example of an immediate immune, immediate non-immune, delayed immune, or delayed non-immune reaction? Now, the cause of transfusion reactions is mainly clerical error. That means that somebody, perhaps they read the bag wrong, put the wrong label on, read the patient chart wrong. It's human error, and that's a big issue, and which is why we try and control it as much as we can. One of the newer technologies that we have now is RFID, radio frequency identification technology here. And what happens, as you can see in the picture, is you have microchips that will allow the patient and the blood to be matched together, and if they don't match, you'll get a signal saying they don't match. So you have a patient with a wristband and a unit of blood, both with a microchip in them or on them. The chip will be able to transmit the blood type from the blood bag or from the patient via radio frequency. If there is a mismatch, there will be a message that flashes up and tells you that this is an incompatible unit of blood and that you shouldn't continue. So you can imagine an emergency situation. It might be nice to get that immediate, uh-oh, we made a mistake because we were in such a rush because this patient is in such critical condition. To have that sort of, oh no, stop what you're doing and grab another bag of blood reminder would be really important. But again, keep in mind, most of these transfusion reactions are the result of a clerical error, so it's absolutely crucial that we know what we're doing when we're performing a transfusion, and we give them the right blood, and we're there to monitor anything that might happen as a result. So just a reminder, what you need to do now is complete your Canvas quiz, answer the 4 multiple choice questions that were given in the presentation regarding types of transfusion reactions, and be prepared to answer questions just like that in class. Not the exact same ones, but similar.